Okay. Good afternoon, everyone. Welcome to day 6 of the 2026 World TCM and Acupuncture Week. Today is the English presentation sessions. I am Tao Xu, and it's my pleasure to be your host today. We are honored to have experts from around the world sharing their knowledge and experience in traditional Chinese medicine, acupuncture, and integrative medicine. Thank you for joining us. We hope you enjoy today's presentations. Let's begin. 首先呢，我们先请到的是傅学礼博士。他有一段的这个视频的录像，他的题目呢给我们介绍的是峨眉气针灸炼质结合，快速去痛。我们现在开始。
各位朋友大家好，非常感谢李荣刚主席的邀请，让我有机会能够在2026第6届世界中医药针灸文化周暨第4届 BC 省法定中医针灸周这个大会期间给大家汇报一下我的峨眉气针灸。那么我给大家汇报的题目呢是峨眉气针灸炼质结合去疼痛。大家可以看一看我大致因为其实峨眉气针灸呢它的内容比较丰富，最主要的精髓就是说炼质结合，快速去痛养生。我是傅学礼博士，那么这是我的一个个人简介。我其实创立气针灸已经20年了，然后呢我以前是应该在武术上面取得了一些比较2个世界冠军等等的，在武术界还算是有一定的影响，也教了很多年的拳，所以从20年前我就创立了武医结合的这个系统，后来呢又在樊岱明院士的整合医学这个思想观念的影响下把武医呢更进一步的推进了整合医学的这个范畴。因为樊院士的理念呢是说整合医学包含了中医、西医、物理治疗医、脊柱神经医及各种能够治疗人体健康的这个方法综合到一起，以人为本，这是很重要的一个中医的观点。樊院士本来是西医，那么以人为本来帮助人体健康的这些医学整合到一起，把人作为一个整体来看待，提高人的身体健康，所以它包含了太极、气功各种健身生活方式。而其中很重要的就是我们传统的中医和这个传统的我们的武术里边也包含了太极、气功、内家拳这些太极、形意、八卦、内家拳这几个内家拳对身体健康的帮助是运用的比较多一点。所以呢我一直20年前就搞了这个武医的这个系统，因为这个基础是在我们我以前是成都体育学院学运动医学毕业的，因为我的父亲跟着郑怀贤老师第3任中国武协主席、中医骨科专家，他创立了我们学校的运动医学系那么所以一直在这个传承下，我们就进行了一些研究，在美国以后也在用这个方法来治病。我也在全美的前10名的自然疗法诊所做了大约20年的时间。那么这个基本的3条就是炼质结合，以气相连，练太极气功，提升整个能量，用各种方法外治，强力打通气点，这样呢就可以快速的去除疼痛。对疼痛的研究我们现在也算是比较透彻了，就一般的 痛症都不是什么问题。所以我们长期在治疗全世界来的病人，这个做各种疑难杂症的这个治疗，包含了各种忧郁症各种疑难杂症的疼痛睡眠等等，这些都是有很好的办法，主要是用练和治结合，打通气点的办法来调整。那么下面我就因为其实内容很多，我只能快速的给大家先过一下。气功呢，它分成硬气功和这个健身气功，这个是以前硬气功表演的一个视频，给大家还是就不看了。这个我们再进入到硬气功由硬到软的练功的过程，然后我把气功呢大致分成了外动引发内动的第一类气功。通过抖动，我发觉最快速的就是你站起来，就这样站起来做一个抖动，它可以迅速的就这样抖但是一定要保持一个动作，不要做大的改变，抖3到5分钟，它可以迅速的改变你人体的气的运行方式你可以自己试验一下，从内到外的抖动。3个原因造成这个有效，第一个是经验，第二个呢就是人体就像一瓶药，也许不平，抓过来摇一摇抖一抖就平衡了，我们调整微平衡。第3个就是磁场，人体有个磁场，地球有个大的磁场，通过抖动可以迅速调整人体的感觉，气息的运行。那么这是一个快速找到气的办法，你只要这样跟着我，哪怕抖1分钟2分钟，然后突然停下来，你现在就能感觉到手心麻麻胀胀，这就是第一个最基本的气功。那么第二类的气功呢，就是呼吸配合意念。那么第3类呢是动作配合呼吸。今天没有那么多的时间，我想着重给大家稍微介绍一下一个桩功的练习。这个桩功呢叫做三体式。怎么做呢？大家可以看一看，我的脚要站在一条线45度，然后前面站在这条线的另外一边，然后呢你的人体要站好，然后做一个，我想着重今天主要介绍一个三体式的练习。大家可以看一下，这个三体式是后脚45度，前脚平行于地面，两脚之间的距离大约只有半个脚掌，然后呢身体下沉，就像这条线一样，大家可以看得更清楚。2条腿一屈，但是胯要和这条线垂直，胯正而身斜，浑身放松的下沉，然后呢45度屈膝，身体重心下沉，胯要正对前面。在这个基础上，下面这个手要腕横纹对着肚脐眼往里面压，前面这个手和你的鼻尖一样平，就要做成这个状态。这叫三尖相对，鼻尖、指尖、足尖相对，三圆，虎口撑圆，然后呢胸要圆起来，含胸拔背，背要圆起来。那么这种动作站在这里，顶头竖向，浑身放松，感觉是松沉的往下走的。那么这是第一个三体式的站立。那么在这个基础上，你可以做提肛功，就变成了一个叫做鸡腿桩的练习。这是我今天着重给大家介绍的。如果大家按照我这个方法练，可以迅速的得到身体1个星期你就觉得不一样。那么你做的时候就是吸气尾闾往前，呼气放松，吸呼。吸的时候尾闾往前，后脚更是屈一点，身体下沉，前面的脚也屈，呼微微站直，吸的时候收紧，呼的时候放开，感觉力量从后脚传递到前手。这是一个三体式的鸡腿桩的练法，浑身放松站在这里。那么还有一种练法就是只动肚子，吸气收，呼气顶，吸气收，呼气顶，保持撑圆的状态下做这个动作，可以练习丹田的收放， 可以感觉内在的气息从后脚传递到前掌。最后一个加强版就是绕一个圈儿，就是感觉后脚蹬起来，把力量传递到前掌，手不动只动脚，胯在做一个溯源的一个练习。那么同样的配合也是，当你下来的时候吸，站起来的时候是放，吸呼吸呼，那么你转起来呼吸呼吸呼。好，这是一边的练习。如果你这样练，可以迅速的提高。同样的换另外一只脚啊，这个脚45度站起来撑起来，这就是另外一侧。同样这样练习，那么你就能感觉到不一样的这种练习。这就是我说的，今天着重想给大家介绍人人都能学得会的一个桩功的练习，叫做鸡腿桩。这是形意拳当中的一个很好的练法。今天在练的部分呢，其实我有很多，但是呢，我今天想着重的给大家介绍一下，不是普通的其他的一些练功方法。除了一个抖动功以外，我教了大家一个提肛功。提肛功就是在鸡腿桩的基础上来做这个练习。那么在这个部分呢，我们做一个稍微深入的了解，因为我希望大家在这短短的半个小时当中能够有一个学会一到两样东西，那你就很好了，然后其余的有个了解就行了。这些呢都是很多内容，我今天着重就刚才讲了一个抖动功，再讲了一个形意拳的鸡腿桩。那么太极今天就不讲了，其实我最拿手的是传统杨式的太极和太极推手但是我就不讲了。希望大家呢能够真正的打到传统的太极。大家可以看看这个视频，这就是真正传统的太极。大家一定要注意，它是跟着内气运行走的，就是吸气呼气，浑身放松，气下沉，然后呢抓脚趾挺膝盖，提肛收命门，用腰带手，把手提到与肩平，略高于肩，停住，开背环状收回，停住，手指转正，4个动作：沉肩坠肘，坐腕下沉屈膝，跟着里面走，松肩松腰松臀松大腿，膝盖小腿踝关节的时候正好松到下面，最后把气放下去，这样才开始打传统杨式。感觉手心当中抱着一个球，往前一根步就清楚的感觉到这个气球在你的掌心下，然后控制住左后方触角跟，圆裆开胯，正捧，然后呢侧捧，感觉人体在气球的里边撑着，然后呢护耳护裆，然后探右脚跟出去，圆裆，后脚撑起来，前脚微屈，身体捧出去，双捧搭对方的手，上动下不动，下动上不动，莫转心不转，这样才真正的传统太极拳，一直是跟着内劲在走。松开下沉，感觉力发于足跟主宰于腰，行于手指，两手交叠向外推，然后接住对方的劲，慢慢的收回来，空开，收到不能再收，再从后脚翻起来，力量从足到肩到肘到掌根慢慢的按出去。好，这种才是真正的太极拳。那么还有很多内容，我就只能给大家初步有个概念。那么因为我今天还想稍微讲一讲形意拳配合六字诀的练法到最后的阶段哈。那么我的峨眉气针灸分了2个部分。第一个部分对专业的医生来讲呢，它可以深入一点，原理是一样的，就是打通气点可以治疗疼痛。那么对一般的老百姓来讲，他没有执照不能扎针，那就用点按的方法，一样的可以快速达到去除疼痛的效果。那不外乎就是你要多做一些时候，慢慢的你就可以达到这个效果。原理就是通则不痛，痛则不通，任何人都学得会。那么主要是打通气点。 点按气点3分钟就可以消除各种疼痛。练呢就可以，你练个一些简单的功法，就像我们刚才讲的原地站着的，你也就可以练，或者是等一下讲一个稍微复杂一点的，你练一下这个形意拳的6字诀配合这个劈崩砖炮横5个拳法，都可以对应到不同的脏腑来练。那么练这些，它把整个元气提升了，你任何疼痛都会有一定的减少。那么它的原理就像是你那个水管不通了，那怎么办？2个办法。第一个就是增加它整个的气量、水量，让它压强增大，它就自然会打通一些。第二个方法，那就是用外治的方法，把那个堵住的地方用一个棍子拨一拨，用个机器穿一穿，那么这样把气点打通，堵住的地方疏通了，它也会快速的让气通过，你也就不痛了。这就是最基本的一个比喻的方法哈，大家可以了解。那么气针灸是什么啊？这些原理我也就不讲了。这个如果大家有兴趣想要仔细了解，可以待会儿扫一下我的微信，我把 PPT 发给大家，大家自己可以来根据 PPT 来了解一下。还有我有一些更多的资料可以发给你这个就不看了。头痛啊这些，其实我的 PPT 是整个非常全面的一整套，从头到脚的都有哈。但是呢很简单，你比如说头部的，你最主要的头部的点按就是处理枕下肌群横着拨，然后呢再处理翳风穴上下拨，第3个呢再松解第一颈椎横突，就几乎可以处理所有头部的问题，包括现在讲的中风、震荡、脑震荡、癫痫、忧郁、感冒、发烧、痴呆、鼻子过敏、青春痘，这些都可以用这个简单的方法来去除疼痛这都是有直接道理的。它通过筋膜学说把筋膜给你活动一下，然后你的气就过去了。因为现在研究很多气机的阻挡点，气点都在这个筋膜的阻塞上造成的所以说呢这个不是要点，等一下我再讲个膝痛的问题哈。现在我们先跳回到练的部分。那么因为其实治疗每一个部位都有很多方法，那么我想刚才讲了一个形意拳的鸡腿桩，那么除了形意拳的鸡腿桩，我们在练的部分呢还要注意的就是6字诀融合形意5行拳有一个基本的练习。这是我和我的女儿傅薇莹在这个练功当中，因为我当时在教她，然后我偶然间发觉这2个配合的非常好。为什么呢？因为6字诀大家都知道体育总局就发行了的，它能够配合调整你的5脏，比如说湿调肺，这个吹调肾，虚调肝，呼调脾胃，那么它的这个喝调心，这是5个字。调三焦呢就是用喜字诀，这个呢来源于这个孙思邈我们孙思邈那个时代就到现在了。最开始就是发觉吃饱了，那么这样打开呼，就会发觉这样呼完以后就有帮助消化和通气、调脾胃的作用，就这样慢慢来的。那么从这个完全就是一个5行的相生相克的一个配合得上6字诀的话，这里边你看肺就属金那么在形意拳当中呢恰好也有这个5行的说法。形意5行拳它有专门5个拳对应了金木水火土，那么劈拳就是四符属金调肺湿字诀。那么那个劈拳就是它不是只是往拳推，它是练的是往下劈的这么一个力量。所以说呢劈拳四符属金调肺，这是我们可以稍微演示一下的，因为这也是最基础的一个拳。那么原地练的劈拳可以慢练，发长音平行站收回来，吸，然后慢慢的加力， 想要真正打出力量来，你就会发觉你必须既要下沉又要往前。这是原地的。那么行进间的它也有一套练习的方法。那么行进间就是来源于我们刚才的三体式，站成三体式，那么来打劈拳。也就是说一脚站在一条线的两侧，然后你做劈拳的时候呢，吸气呼气，既是劈又是推，下手还要往回拉，前手用这个前手打人，后手发力，这样子才能真正的把力量打出去，而且呢，臀部还要敛住，不能够翘屁股。这是原地三体式的练法。那么在行进间，它也是你要在行进间，这是慢练也可以快一点，这就是劈拳。当然劈拳要练好，它有个程序的。第一个要练蹲喉桩，练丹田的发力；第二个要练劈柴，劈一阵你就发觉身体下沉才是关键；第三个要练前后，你要练后脚油门，前脚刹车；第四个就要练三体式；第五个就要练鸡腿桩；第六个就要练后脚发力到前手，然后才说原地的，才说原地三体式的，然后才说行进间的，这都是单操。这个形意拳的劈拳它有个程序的。那么我有详细的视频，今天是没有时间了，但是呢，我把它讲完。劈拳是腹属筋调肺丝字诀。那么这个钻拳，第二个拳就是钻拳，钻拳就是属水，调肾就是吹字诀。那么下一个就是崩拳，属木，调肝虚字诀。再下一个炮拳，属火，调心喝字诀。横拳属土，调脾胃呼字诀。这五个诀正好配合了五个拳，配合了五行。那么再加一个调三焦的，调整个的上焦、下焦、中焦，开头和结尾就可以把它放成一个我们的这个喜字诀，喜三焦。时间的关系，我就给大家放一个完整的视频，一次就可以了。大家请看这个视频，它是表示的长音发力养生，短音快练发力。这是第一个吹字诀，丝字诀，虚字诀调肝属木，呼字诀属土调脾胃，然后这是一个调整气机下行的一字，然后这是调心的属火的喝字诀，最后收视调三焦字都是用6个字配合行意五行拳。那么给大家看一下现在真正的发力短音发力的一个快练，它同时也是配合了6个字。开始是吹调肾，丝调肺，虚调肝，这就是传统的形意五行拳，传自我的老师王富田老师。那么再加上我偶然发掘的这个形意6字诀放进去，它有很大的好处，它可以发音不会憋气，不容易得高血压，不容易爆血管，不管你用多大劲儿，都可以帮助身体 紧张放松，但是又对血管血压时有帮助，没有坏处。所以我觉得这是一个非常值得推荐的动作。其实这2年我们对痛症的研究已经是非常多了，除了对我们以膝盖痛为例啊，我们以膝痛为例来谈一下痛症。膝盖痛其实既要了解它的经络穴位的运行，又要了解它的肌肉的特色。围绕着膝盖有16条肌肉，你要把它大致都搞清楚，这样你心里就有数了。这2年的潮流是不只以经络穴位为基础，还要了解解剖基础，这样子你治病的效果才会比较快。而且呢，从这些这么多，那么对普通的民众来讲不需要，你就把这3步搞清楚，就是血海梁丘委中，基本上就解决了大部分的疼痛，而且往往有奇效。方法就是病人坐下来，你的手面向他，搭在他的膝盖上，大拇指的位置正好就是梁丘，外侧就是大拇指的位置就是血海，外侧就是梁丘对应的。那么下面腘窝处就是委中，你用大拇指这样垂直点压一下，一定要垂直于肌纤维的走向，内收肌群是从上往下走的，你要垂直于它左右拨，也要垂直下按，这样才有力。那么你只要拨上用点力，如果力量不够可以用个按摩棒拨个1分钟都不到，30秒立刻就可以快速缓解。一定要有一点痛，因为膝盖痛的人这里肯定痛，痛一下他立刻就缓解了膝盖的疼痛。站起来再用外侧梁丘同样的点按一下，这已经解决了80%左右的膝盖痛了。然后再怕有一些不是这个，它是腘窝里边的腘肌啊、赭肌啊等等这些造成的，用中指再点按一下委中，如果痛多点一下，如果不痛就不用点，就这3个动作解决了90%左右的膝盖疼痛。那么毕竟还有1-20%它有些时候没有达到，那么还可以加一个关节松动的方法。关节松动的原理就是这是膝盖的关节这样活动，那么你是在膝盖的上下，就是大腿和小腿，用手一个向外用力，一个向内用力推着，产生一个垂直的力，再让膝盖做一个弓步的和往回拉直的动作，这样呢就做了一个关节松动，迅速调整关节周边的小关节的紊乱和周边的肌肉韧带松开以后，也是有很好的效果。髌骨也可以稍微推一推，效果也很好，可以增加活动度。那还有很多治疗膝盖痛的方法，比如说头针，你感知以后在头上随便扎一针，它也能治膝盖痛。腕踝针，对侧的尺折，那么它的原理是用分层论治的方法来治疗疼痛，就是疼痛现在对我们来讲呢，已经算是研究的比较透彻了。实际上我们把它分成6层，第一个是表皮层。任何疼痛你表皮层如果做皮连线、筋连线等等的这一些调整，它已经可以治疗疼痛了。那么比如说用个牙签按在皮肤上，隔一会儿它也能缓解疼痛。那么皮下脂肪层第2层，这一层呢是最重要的，正好在浅筋膜外面，皮下有脂肪，血管神经比较少，你用一个扶刺的方法、扶针的方法，傅仲华的扶针、王启才的扶刺或者是陈德成的这个动经针，都在这一层做文章。很多浅刺的，比如说柏志云的腹针也是在浅筋膜层刚刚到，就可以做这个文章，效果也是很好。因为那么再下一层就是浅筋膜层，肌肉外面那层黄黄的浅筋膜层，你用这个劈针在上面高张力点、高应力点刺一个洞，它的效果也很好。这2年比较流行的陈德成老师的动经针法，它其实就是在浅筋膜上用那个特制的针具平着拉了一串洞，它的效果更好，因为它破坏更大嘛，而且呢它又是平刺的，看着又像针，它就这个更加的符合法规一点，那么也安全，唯一就是有的时候还是有一点痛。那么 再下一层深筋膜层，就是在大的肌肉包裹的里边，它是由小的肌束构成的，在小肌束之间还有筋膜。这一层如果往往因为现在研究气的传递，为什么叫气针灸？就是通则不痛，痛则不通。气的传递和筋膜有直接的关系，和浅筋膜、深筋膜都有直接的关系。你看陆老的跳针，你扎跳，往往老针灸医生都知道，只要扎跳了，它扎针的效果就好。哪怕你没扎在穴位的正穴上面，而是扎在它有问题的地方，就是它的气被挡住的地方，它肌肉会不自主的跳一下，那么这个气滞而有效，那么这个是一个典型气滞的表现。所以说呢，扎跳是非常好的一个检测标准。你在上下哪怕没有直接刺激那个疼痛的地方，用一个单法再加一个微电，这就陆老的扎跳方法，效果也是非常好的。在深筋膜层也可以用刘宝库的疤痕松解，你用针自助了拉，或者是自针的方法，缠住肌纤维，然后拉抖动，把周边的筋膜肌肉都松解开，这些都是很好的方法。所以在埋线啊、浅筋膜、深筋膜、腹针啊，都有到浅筋膜为主，有些时候也到深筋膜，它效果都很好。那么再下一层就是第5层，就是直接到了肌肉的肌肤上面，长针斜刺点杀，其实也是直接刺激到那一个肌肉的肌痛点，就是所谓的 trigger point， 就是干针的疗法。干针我们反对，主要是从技术上不反干针，主要是从它来抢占我们针灸师的这个治疗领域。有物理治疗师学这个30个小时，我们学3000个小时，相差100倍。就同样可以扎针，这个我们反对。那么骨膜再下一层是骨膜层，到了骨膜，因为血管神经比较丰富，往往刺激比较强，也能对疼痛产生立刻的改变。那么最后一层就是骨头了。那么到骨头了，你就是直接中国的传统正骨，或者是美国的 chiropractor， 脊柱神经科医生，他都要骨正筋柔，筋出槽骨错缝。中国自古以来就有正骨的方法，跌打的师傅特别会这个。像我们郑怀贤老师这一脉，直接骨折的都可以闭合性的把它复位合上，再用这个小夹板固定。那么我觉得所有治疗疼痛当中最强的还是小针刀，这是核弹级的方法，但是呢破坏性也大一点，在海外是灰色地带，但在中国也用了40几年了。小针刀它有个发展过程，最开始是朱汉章老师创立小针刀，是人的手指打不开，他扎了以后立刻打开，他就是哪儿痛扎哪儿。那么第二层呢就是扎肌肉的起止点，后来发展到第3级治疗呢，就是卢胜存老师创立的扎这个控制这个肌肉被卡压的神经，改善它的供血，整个肌肉的血供改善，那么它会缓解这些疼痛，特别一些疑难杂症。所以从这个角度来讲，它也可以治疗很多，现在在研究治疗很多内脏病，比如说高血压、糖尿病等等，这些效果都取得了很好的效果。那么时间的关系呢，确实就没办法再多介绍了，比如说董氏奇穴呀、头针啊，这些都是很好的方法。希望大家呢对今天峨眉气针灸有所了解。简单讲，峨眉气针灸总的来说就是一个练和治结合的事儿。练就练气功太极的形意八卦，内家拳来养生，提升你的元气。治呢就是各种外治的方法，不太懂的人用普通的这个保健点按方法就可以达到，很快。那么医生可以用各种针法，在这个基本的理论基础上，以经络穴位和解剖为基础来治疗这些疾病，效果往往很好。时间关系没有办法详细介绍，各个地方都可以，每一个部分都可以讲很长的时间。我可以把相关的 PPT 发给大家，请大家有兴趣的可以加我微信，我到时候发给大家，好吧？好，谢谢大会主席 李荣刚主席的邀请，也非常感谢大家宝贵的时间来聆听峨眉气针灸的介绍，谢谢。我们今年12月在美国斯坦福大学，我们也第10届整合医学大会，也希望大家踊跃参加，欢迎联络，谢谢。
谢谢傅学礼博士给我们带来非常精彩的演讲。Okay, so our next presenter is Li Taobai. Li Taobai is original from China and is an integrative medicine physician at the second affiliated hospital of Chongqing Medical University. He specialized in traditional Chinese medicine for endocrine and metabolic disorders, with a particular focus on obesity and integrative approaches to metabolic health. Today, he will present holistic approaches to obesity in traditional Chinese medicine. 下面我们观看Dr. 李桃白给我们发来的视频。
Good morning, ladies and gentlemen. Welcome to my presentation. It is an honor to stand before the international audience today. Obesity is one of the most pressing global health crises of the 21st century. In Western medicine, we often look at it through the lens of carry-in versus carry-out, endocrine pathways, or genetic predisposition. Today, I want to invite you to look at this global epidemic through a different, time-tested lens, the holistic philosophers of traditional Chinese medicine. Over the next 25 minutes, we will explore how Chinese medicine understands the root cause of obesity, how we differentiate different patient profiles, and how we apply a rich toolkit ranging from herb formulas and acupuncture to lifestyle diet and physical therapies to achieve sustainable, personalized weight management. Here is the roadmap for our journey today. We will start with an introduction to the basic concepts and historical perspectives. Then, we will dive into etiology, why obesity happens according to Chinese medicine. Next, we will discuss syndrome differentiation, which is the heart of Chinese medicine clinical practice. Finally, we will cover practical interventions, herbal medicine, acupuncture, tuina massage, dietary therapy, and long-term prevention strategies. Let's begin with the basics. In Chinese medicine, obesity is not just about excessive adipose tissue. It is a manifestation of internal disharmony. We identify three core pathology mechanisms here. First, spleen deficiency and excessive dampness. In Chinese medicine, the spleen is not just an anatomical organ. It represents the entire digestive system, responsible for the transportation and transformation of food and fluid. If the spleen qi is weak, it cannot transform food into usable energy. Instead, this essence stagnates, turning into pathological fluid called dampness and phlegm, which eventually manifests as fat deposits. Second, qi stagnation and blood stasis. Chronic stress or poor diet blocks the smooth flow of energy, or qi. When qi stagnates, blood circulation slows down, creates blood stasis. Together with phlegm, this leads to localized fat accumulation, particularly around the abdomen. Third, congenital deficiency. Some individuals are born with weaker kidney yang. The kidneys are the root of our body's metabolic fire. If this fire is dimmed, fluid metabolism slows down, leading to what we call flame-drinking obesity. Chinese medicine has been treating obesity for over 2,000 years. As earlier as the Han Dynasty, the Huangdi Neijing Inner Canon notes that obesity was common among rich and noble people who consumed too much sweet, greasy food and liquid physical activities. This ancient text pioneered the concept of 治胃病, preventing disease before they occur. Later, the legendary physician Zhang Zhongjin introduced the concept of 痰饮, flame fluid retention, and created formulas like 灵桂竹甘汤 to dry dumplings. During the Tang and Song dynasty, Sun Simiao championed the concept of food and medicine sharing the same orange. Utilizing common food like yi ren for weight control. By the Ming and Qing dynasty, physicians like Li Shizhen classified the obese patients into categories like crying person and fat persons, paving the way for the highly customized treatments we use today. Why is this ancient wisdom relevant today? Modern research shows that Chinese medicine interventions like acupuncture and herbal medicine has a profound impact on metabolic syndromes, insulin resistance, and chronic inflammation, often with fewer side effects than conventional weight loss pharmaceutical. Furthermore, Chinese medicine does not offer a one-size-fits-all solution. It offers personalized conditioning. If you have two patients who are both 100 kilograms, but one is constantly fatigued with a pale tongue and the other is irritable with a red tongue, Chinese medicine treats them with entirely different protocols. Finally, we focus on prevention and maintenance, combining modern wellness with traditional exercise like 八段锦 or seasonal diet. Let's take a closer look at the why, what goes wrong inside the body. First and foremost is spleen deficiency. When spleen qi is compromised, the body's metabolic engine slows down. The patient feels tired, has a bloated abdomen, and shows a thick, greasy tongue coating. Second is liver qi stagnation. The liver is responsible for the smooth flow of qi and emotions. When we were stressed or emotional, the liver qi gets stuck. This disrupts bile secretion and lipid metabolism, frequently causing emotional eating and abdominal weight gain. Third is kidney yang deficiency. Think of kidney yang as the body's internal furnace. When it runs cold, fluid metabolism stalls, leading to water retention, cold extremities, and low limb edema. Of course, internal weakness is triggered by external factors. An unrestrained diet-rich in sweet, greasy, and heavy foods overburden the spleen, leading to what ancient texts call the disease of sticky beans, highly parallel to the modern calorie surplus. A secondary lifestyle slows down qi and blood circulation. As the saying goes, prolonged sitting damages the muscles. We also look at environment dampness. Living in human environment can cause external dampness to invade the body, combining with internal dampness to make weight loss even harder. Lastly, irregular sleep. In Chinese medicine, the gallbladder and the liver meridians detoxify and regulate lipid between 11 p.m. and 1 a.m. Staying up late damages this cycle, leading to overwork obesity. In chronic obesity, these factors don't exist in isolation. They interact. Flame dampness blocks the meridians, which slow down blood flow, leading to blood stasis. You will see this in patients with purple spotted tongue, dark skin, complexions, and often metabolic syndrome or cardiovascular issue. Therefore, the essence of obesity is often deficiency in the roots and excess in the branches. Our treatment strategies must balance both, qualify what is deficiency and portion what is stagnant. Now let's explore clinical diagnosis through syndrome differentiation. The first and the most common type is spleen deficiency with dampness accumulation. These patients present with soft flabby obesity, heavy limbs, fatigue, poor appetite, loose stools, and a puffy tongue with teeth marks on the edges. Our treatment principle here is simple. Invigorate the spleen, boost qi and drain dampness. They often use formulas like Shenling Baizhu powders combined with Erchen decoction. On the body, they target acupuncture points like Zu San Li and Yinling Quan to stimulate the spleen's transportative function. The second type is liver qi stagnation with heat. These are your stress, anxious patients. They experience emotional instability, rib pain, a bitter taste in the mouth, dry throat, insomnia, a red tongue with a yellow coating, and a rapid, wiry pulse. Their obesity is often driven by emotional eating. Our goal is to smooth the liver, clear heat, and harmonize the qi and blood. We prescribe 柴胡疏肝 powder or 丹栉逍遥 powder. with acupuncture points like Taichung and Xingjian to vent liver fire, and recommend smooth lifestyle modification like 菊花 team and stress relief exercise. The third type is kidney yang deficiency. These patients present with cold obesity. They are sensitive to cold, have cold lip, lower back pain, frequent urination at night, a pale tongue, and a weak pulse. This is common in elderly patients or those with long-term metabolic slowdowns. Our approach is to warm and toniify kidney yang and promote diuresis to reduce edema. We modify classical formulas like 金匮肾气皮 or 真武 decoction. Moxibustion is highly effective here, particularly at Guanyuan and Minmen, to revive the metabolic fire. Let's look at our formulas. We have 3 classical formulas that serve as the foundation of weight management. 葛根芩连 decoction supports weight loss by reducing metabolic inflammation and improving insulin sensitivity. 五苓散 formulates with Poria and 泽泻. It focuses on regulating fluid metabolism for spleen deficiency patients with water retention. 二陈汤 the gold standard for driving dampness and transforming flame, especially targeting abdominal fat and chest tightness. In practice, we customize this for spleen deficiency. We add herbs like huangqi and cangzhu. For liver stagnation, we add yujin and xiangfu. For excess stomach heat, we use baihu tang with rhubarb to clear heat and ease excessive hunger. As medical professionals, safety is paramount. Chinese medicine herbs are highly effective but must be used with caution. Laxative herbs like rhubarb or senna should not be used long-term or combined with Western laxative, as they can cause electrolyte imbalance. Ephedra-containing formulas must be avoided in patients with hypertension. Furthermore, cold, heat-clearing herbs can damage a yang deficiency patient's digestion. We must always monitor liver and kidney function, especially when patients are on long-term protocols, and balanced portion herbs with tonified herbs to promote the body's upright qi. Now let's move to acupuncture. We target key points to regular metabolism. 足三里 harmonize the stomach, improve digestion, and strengthen the spleen. 中脘 regulates the middle burner to reduce abdominal bloating and dampness. 丰隆 the ultimate point for clearing flame and lowering blood lipid. We also use ear acupressure by placing 王不留行 seeds on points like the hunger point, stomach point, and endocrine point. Patient can self-stimulate this area to suppress appetite and balance hormones between treatments. For electroacupuncture, we use low frequency on the abdomen to promote local fat breakdown and high frequency on the limbs to elevate overall metabolic rate. For patients with cold and yang deficiency, moxibustion is our therapy of choice. Applying ginger-separated moxibustion on guanyuan warm the kidney yang and boost the basal metabolic rate. Applying salt moxibustion on shenque helps resolve abdominal fluid retention and diarrhea. We also use moxibustion on the back over pishu for 20 to 30 minutes to strengthen the body's transformation capacity, which is especially beneficial for office workers who sit all day. Chinese medicine physical therapy offers wonderful mechanical and thermal benefits. Tuina massage along the spleen and stomach meridians promote qi and blood flow. For abdominal fat, we use circular abdominal massage, massaging clockwise around the navel for 15 to 20 minutes. This mechanical stimulates bowel peristalsis, relieves constipation, and targets visceral fat. We also utilize cupping therapy, flashing cupping, rapidly applying and removing cups, stimulates local microcirculation. Medical cupping, where we soak the cups in herbs decoction like dangshen, allows the warming herbs properties to penetrate deep into the adipose layers to break down stubborn fat. Now, weight loss program is complete. Without diarrhea management in Chinese medicine, we look at the energetic properties of food. We avoid cold and raw food like ice water and raw salad for spleen deficiency patients as they put out the digestive fire. Instead, we encourage warm cooked food like ginger and yam. We also utilize the 5-flavor sour foods like shanja help digest fats. Bitter foods like bitter melon clear heat. Seasonal alignment is also key. In summer, we focus on clearing heat and dumplings with winter melon and mung beans. In winter, we warm and nourish the spleen and kidney, but control portion size to prevent flame accumulation. Instead of high intensity, stress-inducing workout that can deplete an already deficient patient, Chinese medicine advocates for qi cultivating exercise like Tai Chi and Ba Duan Jin. The movement in Ba Duan Jin, such as regulating the spleen and stomach with a single lift, physically stretch and stimulate the digestive meridians. Furthermore, the slow abdominal breathing associated with Qigong activates the nervous system. This lower cortisol, the stress hormones responsible for visceral fat accumulation, making it a highly effective tool for stress-induced abdominal obesity. Finally, how do we prevent the dreaded rebound effect? Once the weight is lost, we transition patient to consolidation therapy using formulas like 补中益气汤 to clog in the spleen strength. We maintain weekly acupuncture or ear tapping to keep hunger hormones like ghrelin in check. In the modern world, we can integrate this practice with contemporary wellness. Be combined with low GI diet with traditional Chinese medicine herbs like Chinese yang. We also use wearable technology to track steps and sleep, aligning them with the traditional Chinese medicine organ clock, encouraging patients to eat their largest meal during spleen time, 7 a.m. to 9 a.m., and be asleep during gallbladder liver time, 11 p.m. to 3 a.m. to optimize natural lipid metabolism. To conclude, obesity is not just a cosmetic issue or a simple calorie math equation. It is a sign of internal disharmony. By using traditional Chinese medicine, personalized holistic toolkit, balancing deficiency, clearing stagnation, and living in harmony with nature, we can help patients achieve sustainable health and vitality. Thank you very much for your time.
Thanks a lot for Dr. Baili Tao's presentation. So our next presenter is Ying Feng. Dr. Ying Feng is from China and is an attending physician in the Department of Oncology at Suzhou Municipal Hospital. She specializes in integrative oncology with a focus on the body-mind approach to cancer care, psycho-oncology, and the use of traditional Chinese medicine to improve the quality of life for cancer patients. Today, she will present Treating the Whole Person, the Body-Mind Unity in TCM Oncology. Yeah, now we can watch the video from Dr. Ying Feng.
Good morning. It is a great pleasure to be here with you during the World Traditional Chinese Medicine and Acupuncture Culture Week. I'm from Suzhou Municipal Hospital. My name is Feng Ying. Today, I would like to talk about a topic that is both ancient and very relevant to modern life: treating the whole person, the body-mind unity in TCM oncology. This talk is not only for doctors or researchers, it is for everyone who cares about health, cancer prevention, cancer recovery, and the quality of life. Cancer is one of the most serious diseases in the world today. Many families have been touched by cancer in some way. When people hear the word cancer, they often think of tumors, surgery, chemotherapy, radiotherapy, or hospital treatment. These are very important parts of modern cancer care. But today, I would like to invite you to look at cancer care from another angle. A cancer patient is not only a body with a tumor. A cancer patient is a whole person. This person has pain, tiredness, appetite changes, sleep problems, fear, sadness, hope, and family responsibilities. Therefore, cancer care should not only focus on the tumor itself, it should also care for patient's body, mind, emotions, daily life, and dignity. This is very close to an important idea in traditional Chinese medicine, or TCM. Body-mind unity. In Chinese, we call this 形神一体。形 means the physical body. 神 means the mind, spirit, emotions, and vitality. 一体 means they are one integrated whole. So, the main message of today's talk is very simple. To treat illness well, we must care for both the body and the mind. What does body-mind uniting mean? Let us begin with a simple question. What is health? Many people may say, health means having no disease. But in TCM, health means more than that. Health means that the body is functioning well, the mind is calm, emotions are balanced, sleep is restful, digestion is smooth, energy is sufficient, and the person feels connected to his life. In TCM, the body and mind are never separated. The body influences the mind. For example, if someone has severe pain or poor sleep and long-term fatigue, it is very natural that this person may feel anxious, depressed, or hopeless. At the same time, the mind influences the body. If someone lives under long-term stress, fear, anger, sadness, or worry, the body may also suffer. Digestion may become worse, sleep may become poor, pain may feel stronger, and energy may decrease. This is not difficult to understand. We all have similar experiences. When we are nervous, our stomach may feel uncomfortable. When we are sad, we may lose appetite. When we are under pressure, we may not sleep well. When we sleep badly, we may feel tired, irritable, and more sensitive to pain the next day. This is a body connection. TCM described this connection thousands of years ago. In the classic text, 黄帝内经 or the Yellow Emperor's Inner Classic, there is a famous idea. When the body and the spirit are harmonious, life can be strong and complete. Another classical saying is, when the mind is calm and the spirit is preserved, healthy qi can flow smoothly. In modern language, we may say, when the body and mind are balanced, the person has better resilience. Resilience means the ability to recover, adapt, and keep going during different times. For cancer patients, resilience is extremely important. Why is body-mind uniting important in cancer care? Cancer treatment has made great progress. Surgery, radiotherapy, chemotherapy, targeted therapy, and immunotherapy have helped many patients live longer and better. However, cancer treatment can also bring many changes. Patients may experience pain, fatigue, nausea, poor appetite, dry mouth, sleep problems, anxiety, fear of recurrence, depression, loneliness, loss of confidence, changes in body image, worries about family and future. Some people may say, the tumor is controlled, but I still do not feel well like myself. This sentence is very important. It reminds us that cancer care is not only about test results, scans, or tumor markers. It is also about how a person feels, sleeps, eats, moves, thinks, and lives. In TCM, we often say that illness may involve both the root and the branches. The tumor and the symptoms may be the visible branches. The person's inner strength, digestion, sleep, emotions, and immune balance may be part of the root. Of course, TCM should not replace standard cancer treatment. If surgery, chemotherapy, radiotherapy, targeted therapy, or immunotherapy is needed, patients should follow their oncology team's professional advice. But TCM, acupuncture, lifestyle care, diet, movement, breathing exercises, and emotional support can often help patients feel better during the cancer journey. This is the value of integrative oncology. Integrative oncology means combining the strengths of modern cancer medicine with safe and appropriate supportive therapies, including TCM and acupuncture. The goal is not only to fight cancer, the goal is also to support the whole person. How does TCM understand cancer and the whole person? In ancient Chinese medicine, cancer-like conditions were described with names such as masses, accumulations, or heart swellings. Although ancient doctors did not have microscopes or CT scans, they observed the human body carefully. From a TCM point of view, cancer is often related to long-term imbalance. Some common ideas include, first, deficiency of healthy energy. In TCM, we call this healthy qi or zhen qi. You may think of it as the body's strength, defense, recovery power, and vitality. When healthy qi is weak, the body becomes less able to maintain balance. Second, stagnation. TCM often talks about qi stagnation and blood status. In simple language, this means that the body's circulation, movement, and regulation are not smooth. Long-term stagnation may contribute to discomfort, pain, swelling, or other problems. Third, phlegm, dampness, and toxicants. These are TCM terms. For the general public, we may understand them as unwanted accumulations, metabolic waste, inflammation-like states, or internal blockage. They are not exactly the same as modern medical concepts, but they help TCM describe patterns of imbalance. Fourth, emotional stress. TCM believes that emotions are part of health. Long-term anger, sadness, fear, or worry can disturb the flow of qi and affect the organs. This does not mean that emotions alone cause cancer. We should never blame patients for getting cancer. Cancer is complex and has many causes, including genes, environment, lifestyle, aging, infections, and other factors. But emotional health does affect the cancer experience. It affects sleep, appetite, pain, energy, treatment, tolerance, and quality of life. So, in TCM oncology, we ask not only what type of cancer does the person have, we also ask, how is this person sleeping? How is the appetite? Is there pain? Is there a person afraid? Is the person supported by family? Is there fatigue? That gives this person strength. What gift does the person need the most right now? That is treating the whole person. Acupuncture in cancer supportive care. Now let us talk about acupuncture. Acupuncture is one of the best-known TCM therapies. Very fine needles are inserted into specific points on the body to regulate qi, blood, and organ function. For cancer patients, acupuncture is used widely as supportive care. That means it helps manage symptoms and improve well-being. It is not used as a replacement for cancer treatment. May people say, can acupuncture cure cancer? This responsible answer is, acupuncture is not a cure for cancer, but it may help many cancer patients feel better, tolerate treatment better, and improve quality of life. Let us look at several common areas where acupuncture may be helpful. The first, nausea and vomiting. Many patients receiving chemotherapy may feel nausea or vomiting. Modern anti-nausea medicines are very important. Acupuncture and acupressure may be used together with these medicines. One famous point is 内关, or PC6, located on the inner forearm, about 3 fingers wide above the wrist crease, between 2 tendons. This point is often used for nausea, motion sickness, and stomach discomfort. For the general public, gentle acupunctures on PC6 may be useful. You can press the point gently for 1 to 2 minutes on each side, breathing slowly. However, if nausea is severe or persistent, patients should contact their doctor. Second, cancer-related fatigue. Cancer-related fatigue is not an ordinary tiredness. It can be deep, long-lasting, and not relieved by rest. Patients may say, I feel exhausted all the time. I sleep, but I still feel tired. I do not have the strength to do daily activities. From a TCM view, fatigue may be related to weak qi, poor digestion, blood deficiency, kidney weakness, or emotional exhaustion. Acupuncture may help some patients improve energy, sleep, and overall function. Commonly used points include ST36, located below the knee, 足三里. In TCM, 足三里 is famous for strengthening qi and supporting digestion. Gentle movement is also very important. Walking, 太极, 八段锦, or simple strengthening may help restore energy step by step. The key is moderation, not too much, not too little. Move according to your condition. And for anxiety, fear, and insomnia, cancer often brings fear and uncertainty. Many patients cannot sleep well. Some wake up at night and worry about the future. In TCM, sleep and emotions are closely related to the heart, liver, spleen, and kidney systems. Acupuncture may help calm the spirit. Points such as 印堂, located between the eyebrows, and 神门, or T7, located near the wrist, are often used for calming. Besides acupuncture, Chinese herbal medicine is often used in cancer patients. They are very helpful, but must be safe. Many people are interested in Chinese herbals during cancer treatment. Chinese herbal medicine can be helpful for some patients, especially for symptoms such as poor appetite, fatigue, insomnia, dryness, sweating, or weakness. However, herbs must be used carefully. Why? Because cancer patients may already be taking chemotherapy drugs, targeted drugs, immunotherapy, blood thinners, pain medicines, or many other medicines. Some herbs may interact with these treatments. Some may affect liver or kidney function. Some may increase bleeding risk. Therefore, the most important advice is do not take Chinese herbs randomly. Do not believe in secret anti-cancer formulas. Do not stop standard cancer treatment because of herbs. Always consult qualified professions. Good TCM treatment is personalized. It is based on the patient's symptoms, constitutions, diagnosis, stage of treatment, and safety conduction. There is no one formula suitable for all cancer patients. And about lifestyle care, daily practice for body-mind balance. Body-mind unity is not only a theory, it can be practiced every day. Here are several simple and practice suggestions. Breathing. Slow breathing can calm the nervous system. A simple method is inhale gently for 4 counts. Exhale slowly for 6 counts. Repeat for 3 to 5 minutes. This can be done before sleep, before treatment, or during anxiety. And the movement. Gentle movement helps circulation, digestion, mood, and strength. Good choices include walking, Tai Chi 八段锦, strengthening, light home exercise. Always adjust the intensity according to medical condition. And about food, TCM values digestion very much. During cancer treatment, eating well is important. General advice: eat warm. Easy to digest food if digestion is weak. Maintain enough protein and calories. Avoid the extreme diet. Avoid unproven starvation cancer diets. Ask for doctors or dietitians if weight loss is significant. Food should nourish the person, not create fear. We also need emotion support. Emotions need care. It is normal to feel afraid, angry, or sad after a cancer diagnosis. These feelings do not mean weakness. Patients should be encouraged to talk, ask for help, join support groups, and stay connected with loved ones. Family members should not only say, "Be strong." Sometimes the best support is to say, "I'm here with you." When should we be careful with acupuncture? Acupuncture is generally safe when performed by trained professionals, but cancer patients may have special risks. Acupuncture should be used carefully if the patient has very low white blood cells, very low platelets, bleeding problems, severe weakness, skin infection, open wounds, recent surgery, radiation skin injury, bone metastasis in certain areas, medical device such as ports or pacemakers. This is why acupuncture for cancer patients should be done by qualified practitioners who understand oncology safety. Again, communication with the oncology team is very important. From fighting disease to support life, modern medicine is very powerful in fighting cancer. TCM adds another important perspective, supporting the whole person. In TCM oncology, we do not only ask, how big is the tumor? We also ask, can the person sleep? Can the person eat? Is the person in pain? Is the person afraid? Does the person have strength? Does the person feel supported? Does the person still have hope? This is the meaning of body-mind unity. It does not deny modern science. It does not replace modern oncology. It complicates cancer care by bringing attention back to the whole man being. So, today, dear friends, cancer care is a difficult journey. It involves medical treatment, physical recovery, emotional healing, family support, and personal courage. The TCM idea of body-mind unity teaches us an important lesson. The body and mind are connected. Symptoms and emotions influence each other. Healing is not only about removing disease. Healing is also about restoring balance, comfort, confidence, and dignity. So, the key message of today's talk is treat the tumor, but never forget the person. Care for the body and calm the mind. Support life, not only fight disease. Traditional Chinese medicine and acupuncture can play a valuable role in integrative cancer care, especially in symptom relief, emotional support, rehabilitation, and quality of life improvement. Let us bring together the wisdom of TCM, the strengths of modern oncology, and the warmth of human care, so that every patient can be treated as a whole person. Thank you very much for today's listening.
Okay, now we continue. So Dr. Monica Tang, are you there?
Yes, okay. I'm here.
Okay, good. Okay, so we are our next presenter is Monica Tang. Ms. Monica Tang is a traditional Chinese medicine practitioner based in Hong Kong. She specializes in pain management, stroke rehabilitation, and integrative Chinese medicine, while actively promoting public health education and the application of TCM in modern healthcare. Today, she will present traditional Chinese medicine in total pain management. So please welcome Ms. Monica Tang. Please go ahead.
Thank you so much. Let me do the sharing screen. Okay. Okay. Is it okay for the PowerPoint? Everyone can see it?
Yes, go ahead.
Okay, thank you very much. Hello everyone. I am Monica. And I'm working in Hong Kong, for in the Chinese medicine field, and today I would like to share with you about the traditional Chinese medicine in total pain management. So I believe everyone of you have experienced some different pain issue, like some pain in maybe in shoulder, in your lower back, or maybe in your knee. So actually pain is everywhere in our life, but like how do we deal with it and manage with it is the key topic, like this key discussion within the today sharing. So in my to me, I think total pain management is about including two components. First of all, is the effective treatment. Yeah, so like either you choose Chinese medicine treatment like acupuncture, massage, or some fire cupping or moxibustion. Those are some treatment for in Chinese medicine field, or you can take physiotherapy. They do some maybe some shock wave. Maybe they use some electricity to help you relieve your symptom. Yeah, and you have to take some active treatment for that. And on the other hand, it's about daily maintenance. How can you avoid those pain? Maybe it is about when you use computer too much in your daily life. Maybe you take some heavy things without some good posture. Those are things that you can you can avoid, and you can exercise more during your daily life. This is about the maintenance part. So just want to ask, do you have any pain for, like, you can in your daily life? Yeah. So for in my everyday consultation, neck pain, shoulder pain, lower back pain, knee pain are some very common issues, and the complaint for my patient. Yeah. So before we go deep into the topic, we can know more about our anatomy of our body. First of all, we have a skeleton system. Yeah, it include the um the different bone structure. Like we have the cervical spine, we have the thoracic spine, we have the lumbar spine, and the sacral. Okay, this this generate the whole the bony structure to support our body weight, to absorb the shock we create in every movement. Yeah. So the bony the bony structure, the spine, our spine, the main function of that we include protecting our spinal cord inside, and then it is also some point for our muscle to connect with our other bones. Yeah, in the middle, we can see that we have different muscles that can connect it with connect with different bones, and that's create our body, the whole body's shape. Okay, and then so what's the function of the muscle? It helps with our movement. When you move your hand, you lift up your hand, lift up your arm, you can feel that the muscle contract, some muscle relax, so that it helps your movement. Yeah. So, but individually for the muscle, they can't move it on their own. So, how do they move? It brings us to the nerve system, the nervous system. We have our brain as our central nervous system with the spinal cord. Yeah, it creates the central nervous system. Our movement, it comes from the signal from the brain, and then it pass on to the spinal cord, and then to different parts of our bodies, and then and so that your muscle can move, you have to generate a signal. Yeah. And for some internal organs like heart muscle, for some intestinal muscle, and then maybe lung, those will have a autonomous nerve. So they will the muscle will contract automatically. Okay, so that's why this create the whole nervous system. So why do you feel pain? Pain is not a good sensation, right, everyone? So I think like it's don't think anyone of you like to have the pain sensation in your daily life, right? But why do we have this pain sensation? Yeah, so it's because that the pain sensation can remind us to avoid some trauma, some harmful things uh, in our life. Like basically when you are doing barbecue, right? So like you start a fire, but like you accidentally you almost touch the fire. What do you feel? You will feel the painful sensation, right? So uh um you will go away from the fire, right? Yeah, you will avoid touching the fire. That's why it warn is serve as a warning to us to avoid the pain. Uh, so that's why we have to treasure the pain signal. It's it means that you have doing something wrong in your the daily movement. Maybe because you use your computer for too long hours. Maybe when you do exercise, you have some posture that doing it wrong. Okay, so our spine, we have a different curve, right? Where for the cervical, you see this is not a strictly a very straight structure, right? It's like the S structure. Yeah. Why does it like this? It's because it serves as a um if if the spine, our spine is straight, yeah, when you drum, so that the force will pass directly from your feet to your head. So like um if if the structure is in curvation position, it absorbs the shock you created in um uh, when you jump or you run or you walk. Okay, so do you have a good posture? Usually, the good posture would be a balanced, upright posture, and then but uh, we are not doing it very we also always encounter some poor posture. Like maybe some of you may have some you may see someone have round shoulders or some flat back or your hip is weighing back. Yeah, so it's mainly due to your um and some weak abdominal muscles and muscle imbalance, something like this. Yeah. And then for your posture, you may check it with yourself. Yeah. If you are doing a standing position, yeah, I believe that a good posture would be this. You may see that your center of the ear is aligned with the shoulder joint, yeah, and the hip joint, and the knee joints, and the ankle joints. They are connected in a straight line, so that it created a it it helps us with a good posture. So that we have to remind ourselves for that. Yeah, if you are in a sitting position, so your head and your shoulder should be in one straight line. Yeah, you can keep checking your posture, but um, it's good to hold your posture for. It's very easy, right? Hold your a good posture for 1 minute or like 3 minutes. But like I I don't believe anyone can hold a good posture for like 3 hours. So if you are sitting for too long, it doesn't help as well. So like you have to avoid sitting in front of your computer for too long hours, like or keeping up only one posture for too long. So what is the posture problem in long run? Um, First of all, you will lead to muscular inactivity and also causing different types of pain. Secondly, is the weight gain. Yeah, because you don't exercise, right? You just keep the posture, right? It brings you the weight gain, or whenever you want to do some exercise, you feel pain, so you stop it. So it brings you weight, right? Okay, and then there is a higher risk for diabetes. Yeah, if you keep sitting keep a posture, you don't move. Yeah. So, and also it leads to poor respirations and blood circulations, and also you feel very fatigued. Yeah. So there's a good an interesting part of your body. So when you are taking the metro, you may see that not everyone is standing very straight, right? They usually um standing, watching, looking at their phones, right, with their head bent. So how heavy is your head? Yeah, your head is almost like 10 to 12 pounds actually. Okay, so how heavy is it? It's just similar to a bowling ball when you do bowling, right? So it's around 10 to 12 pounds. And then when you stand straight, the weight of your head will share, yeah, within the whole body. But when your head is bending down, yeah, for every 50 degrees, you will bring you will it's like when you go fishing, right? Your neck is supporting the weight of your head, right? When you drop, yeah, bend your head, you bring more uh weight to your um neck part. When you bending down like for almost 60 degrees, it brings 60 pounds to your neck. So you can try to touch your neck. Yeah, it's actually a very tiny structure. You can cover it with one hand, right? Yeah. So that it support your head for 60 pounds. Yeah, the loading, the 60 pound loadings will um create a lot of trauma to your neck and create like that brings pain in your daily life. So you may see some X-ray here. Yeah, you see the spine is there's a cervical region. This is, yeah. So you see this is normally as we said, like there should be a cervical curve, yeah, following the green line, right? So it's but it doesn't. Yeah, you follow the red line. It's actually straight like a ruler. So it is a wrong posture. Like this is not a wrong structure. I mean, um, it will lead to a lot of pain because of some muscle spasm that pulls the cervical spine in in this position. Yeah, as you can see in the X-ray, right? Yeah. So you can see um uh, the blood vessel actually it goes along with the nerve, our peripheral nervous system. It comes out from this small hole. Yeah, this one. And then the blood vessel will go into our head, our brain, and different parts of our body parts, and then that's supply the blood and oxygen to different body cells. If the hole becomes small, it will easily cause inflammation, or you will easily hit the nerve, and then you will feel pain. And also the blood supply will lower down. Yeah, and that's bring some other issues. Yeah. So what symptom will cause? by the poor posture. First of all, any one of you have experienced brain fog, in your daily life? Okay, what is brain fog? You will feel that you are like in a is what why does it call brain fog? You will feel that your concentration is lost. Yeah, you can you always forget something. Maybe and also you feel very headache, dizzy, and also maybe some ear ringing, and also some nauseous, maybe some shoulder pain, and then and a poor vision, poor eyesight. Those are some symptoms during this brain fog syndrome. So, why is it like this? It's because of the poor blood supply and the poor oxygen supply, and to your brain, to your brain cells. So, it this it leads to those kinds of symptoms. And there is another syndrome called anterior head syndrome. It's you will feel that when your muscle is under a very is under muscle spasm, you will pull the you will your muscle will be stretched in a very strong is by a very strong force. If you keep looking at your phone or looking at your computers in this position, right? Okay, you lean forward, right? So you keep this posture for like 2 to 3 hours. You will cause different types of pain, like the arm pain, the shoulder pain. Okay, and then the headache like this, to your body part. You will, and also some nervous impairment, and then some if for a long one. And then this one, besides from the cervical region, for your the lumbar region, and when you are standing normally, you can see our lumbar spine is in a perfect curve. But when you are sitting, it cause around 30-degree flatten on your lumbar region. Actually, this flattening helps relax your muscle. So that you will feel, I feel relaxed when you are doing the sitting. But when you do your sitting for too long, this will cause another type of muscle spasm, and then it pulls the lumbar region in. It lost the normal curve. And this we call in medical terms we call kyphosis. This position, and it will cause uneven pressure on your disc. The spine. And it will lead to some lower back pain. Like some very common pain like sciatica. This you can see that the disc, right? It very you can see that our disc if with a circular fiber, it and in the middle, this create like a jelly-like cushion. It's create a cushion for our bony structure so that you can bend down and move. Okay. You can see that the herniated disc, it compress our nerve, so it brings us pain. Usually, if it's in lumbar region, it will compress our sciatica. Okay, and then it bring us the whole leg or lower back painful. Okay, and then the other. So, in Chinese medicine, what are we doing? We solve two major problems in your body. first of all, for our pain, we have the first reason is the stagnation. It's like the when you are experiencing the traffic jam, so that you can see in your body you are experiencing like the same thing for the meridian, for your meridian and your channels, the qi and the blood in your body, is experiencing the stagnation. So that in Chinese medicine we have a saying, 不通则痛, just this is caused by the stagnation of your qi and your blood, so that you will feel pain. And then second one is about the deficiency. Because your body, your joints, and it's about, we have some fluid, right? We have some fluid to have the joint move better. So, but those joint fluid, if your body cannot create enough joint fluid, your joint will move very slowly with pain. Okay, and in Chinese medicine, saying we said this is about the deficiency, of your body, the deficiency of blood and the deficiency of qi to your different body parts, so that you feel pain in that region. Okay, so the deficiency is like this piece of land. You see they are very dry, right? What do you have to do? You have to put in some water and nutrients to nourish the land. Same as your body, you have to use some medicine to nourish your body, so that it will you can deal with the pain. So this is, in Chinese we say that this is 不容则痛. So we use 4 diagnostic method to check with our body condition. It's like a detective, right? So the first of all is the inspection. You can see for your face, we have different colors. So these you can see more in white or pale or in yellowish color. Those are deficiency. This is on the right side. You can see that those are very dark in color. Another type of deficiency, more related to the coldness. And in the middle, you can see that the face turns very red, right? Those very red is not it's also not a good sign. It's about too much fire inside your body, and then it brings you you have to lower down that fire. Okay, this one is for your tongue. This is the normal tongue. It should be with some pale redness in color, and then with very thin coating in white color. And you can see that this is the normal tongue. But for other tongue, you can see this is not good, right? You can see the thick coating, and then the coating, you see the whole tongue, the size of the tongue is bigger than other ones, and then you can see that there is some teeth coating, some teeth compressing on the tongue, so that it leaves with the mark, right? The teeth mark. This means that you have the too much water inside your body. The water retention, so that you have to remove the water dampness. Okay. And then for some other diagnostic method, you see that this occultation, it means that you listen to some particular sound, or the smell, or olfaction, the body the body smells, and then maybe your mouth, your breath, yeah, and then the smell of your stool, and then the smell of your urine. Yeah, so this is how we check on this, on your body condition. And also we will ask question. Yeah, ask different question. Like we have the about your severity, about your characteristic of the pain issue, and then some whole system syndrome. Like, do you have chills or fever? Do you have, how's your appetite? How's your how's your sleep? Yeah, how's your do you feel thirsty? Something like this. For women, we will ask about their menses. Yeah, this is something we want to know more about. And the last one is the palpation. Yeah, we need to check on the pulse to understand more about the body condition of our patient. Okay, and also we will do palpation to that specific region. Yeah, to learn more about the tenderness of your muscle, and how's the pain will in some days, if there is some specific trigger point inside your body. Okay, and then those diagnostic method help us create some um um uh, the first image of your body, and then we have to do more an analysis, yeah, so that we know about your body constitution. For pain syndrome, in Hong Kong, because Hong Kong is a very a wet city, right? The humidity is very high all the time. Yes, it's almost like, yeah, there's a typhoon season in summer, so like it's raining a lot, and it's very high in temperature, so that it's not, actually this those humidity is not good for your joint, so that you feel a lot of pain during your life, yeah, in Hong Kong. So you may see that you should usually encounter some people with some the damp heat constitution, yeah, in Hong Kong, because of the weather. Yeah, the living environment is nearby to the sea, that will bring you those water. Yeah. So, and also some of them may have Qi stagnation. It's because of maybe your in your daily work you have a lot of pressure, or your mood is not good. Yeah, this means Qi stagnation. Yeah, this also as we said, that 不痛则痛. Yeah, so the stagnation of the qi and your blood will cause blood stasis. This also some common constitution for pain issue. So in Chinese medicine, what will we do? We will do acupuncture, or muscle pressure, fire cupping, or some bone setting techniques, or herbal medicine to help during with the situation. For some herbs, we have to different types of combination to help. Like if you need some yin nourishing, yeah, some moistening for your body, you may use some snow fungus, lily bulb, yeah, like the fig, or the papaya, the pear, or those are some food that can nourish your body part. And then if you have to tonify your kidney, you can try to use some chestnut, cashews, walnuts. Those are good food to help with it. And then for qi boosting, especially for your spleen, you strengthen your spleen, you can use the Chinese yam, some lotus seed, yeah, also maybe some dry tangerine peel. Those are qi boosting food. And for your heart, yeah, to nourish the heart, to calm, it's good for nourish your blood. You can try the Sang Ji Shen, okay, and then maybe some 龙眼, and also the date. Yeah, this also helped with your heart to calm your spirit, so that it helps you sleep better. Because pain patient, they have and also encounter pain at night. You may not be able to sleep well. Yeah. And this one is good for your liver. Yeah, protect your liver and support your tendon. You can try some green papaya, and also this one 牛大利, and also 土茯苓, and this also help, yeah, with your joint. Like 牛大利means that you are strong as the ox, as the cow. So like it support your tendon. Okay. We can also try the acupuncture and moxibustion. The acupuncture, we use needle, yeah, into your body, and then helps influencing the flow of qi. We relieve the pain, and also we use the fire cupping technique to help you remove the pain. Like you can see that after cupping, you see different types of body mass, right? This one in purple, deep dark purple color means severe stagnation. This one, you can see that a reddish color, it means moderate stagnation. Yeah, and also I also recommend 八段锦. It's a very good exercise that helps you relax, relieve the pain. Yeah, so it's good for daily maintenance. Yeah, so our sharing will come to this point, right? It's already 8:30. So if you have any question, you may ask here. Okay, I can answer more. So let me pass it back to our chair. Yeah.
Thank you, Ms. Monica Tang. Thank you for your excellent presentation. Thank you very much. Okay.
So I can hear.
So we
like,
will move on. Okay.
Okay.
Yeah. So our next presenter is Neil Boxindou. Mr.
Hello?
Okay.
Yes.
Good. Okay.
I'm
So
already here.
the next
Hi.
presenter is Neil Boxindou. Boxindou is a registered acupuncturist based in British Columbia, Canada, and serves as vice president of the Association of Traditional Chinese Medicine Practitioners and Acupuncturists of British Columbia. He specializes in traditional Chinese medicine, acupuncture, pain management, sports injuries, and post traumatic rehabilitation, while also teaching acupuncture and TCM diagnosis. Today, he will present why are you always tired through the traditional Chinese medicine lens. Please welcome Mr. Neil Boxindou. Go ahead.
Hi. Okay, go ahead. I will share my screen.
Okay.
So let me see. I will just do this, and then I'm gonna go on here. So can everybody see?
Yes.
Okay, sounds good. It should be fine. Just before we start, just double checking the entire event ends at 9, right? Yeah, okay, sounds good. No problem. We'll just start. Okay, so hi everyone, and I'm going to be your speaker right now for this kind of interesting topic. Why are you always tired? Okay, we've been talking about tiredness or exhaustion or like kind of just a general, fatigue for about since the very first of our human civilization. Like, oh, if you feel tired, you need to go to sleep. If you feel tired, try this. If you feel tired, try that. But again, like sometimes it just doesn't work, right? So let's just dive into this topic a little bit deeper, and of course, from a multi-perspective point of view today. And let's go over this topic, like trying to give yourself a little bit more knowledge, and of course, a diagnosis about why are you always tired. Okay. And of course, before we start, as you know, our honorable chair of the Alliance just introduced me, I'm gonna quickly go over this again. So a bit about myself. I'm a registered TCMP, so registered traditional Chinese medicine practitioner practicing in BC, beautiful British Columbia in Canada. I'm also the vice president for ATCMA, which is the association that is helping to support the well-being of the entire provincial TCM profession. I also teach. I'm also the consultant and course developer of TCM curriculum at that school. And also, aside from that, I hike a lot in life. So just a little bit brief introduction from my side so you'll know who I am and what we're going to talk about, and of course, what I specialize today. Okay? So let's go over this topic. What is exactly the fatigue? Okay, fatigue is not just generally speaking like tiredness, exhaustion, whatever, like just a lack of energy, whatever general public think or perceive it as. Okay, it's actually a persistent state of physical, mental, and or emotional exhaustion that rest does not resolve. Okay. So if you are able to just recover, 3 or 4 days after a long hike, after like a big project, after a long day working with, very annoying coworkers, it's actually can't be classified as fatigue. Fatigue, or to have the condition as fatigue, you must be suffering or, experiencing this kind of symptoms or physical, mental, emotional strain for about over a week or 2 weeks. Okay, and of course, resting does not help. So oftentimes, patients would wake up with, things like, doctor, I don't feel I'm rested. I don't feel I had a good sleep. I haven't been sleeping well for whatever time. And oftentimes that will lead into chronic fatigue. Okay. And this kind of condition is actually quite interestingly affects up to 45% of the adults globally. Okay. And of course, its number is increasing because these days with the society, with different countries and of course, geographical politics, everybody's stressed out. So the number is actually going up, very unfortunately. And of course, 20 to 30% of these people actually reports prolonged symptoms lasting about 6 months or more. Okay. This is also one of the top 10 reasons patients seek primary care for. I just don't know what's going on with me. I'm so tired. It's actually much more common than you think. Yes. And of course, some of the reasons why conventional or like Western medicine approaches often, doesn't work or like lack of solution to this topic is that they're oftentimes very symptom focused. Okay, they're not like TCM or traditional Chinese medicine. We focus on the root or the very holistic, systematic view about one individual. They oftentimes just focus on specific symptom. Oh, you are sleep deprived. Take sleeping pills, right? If you are tired, if you are having no energy, a can of Red Bull would fix that, right? Oftentimes, stimulants, sleeping aids would be the category of medicine or whatever the supplement they might prescribe. It doesn't really address the causes. Oftentimes, they may aggravate the symptom, okay? So that leads into the further discussion that most of the people after taking some of these general OTC or over-the-counter drugs or over-the-counter supplements, still feeling tired. So they went back to their doctor again. And this time, some lab tests are, done for the patient. Oftentimes returns to be just very normal. You're healthy. Don't worry. You're healthy. Like nothing to worry about, right? Oftentimes, if you are actually in one of the Asian countries or in Hong Kong right now, you go to the hospital, the doctor would say like you are sub-health or you are in the sub-healthy state, which is like you are okay, your readings are fine. However, you are just not doing too great in overall picture, okay? But not to the level of, getting sick. And also from this perspective, Western medicine doesn't really have a good interpretation about this. So they'll just heavily focus on mind-body connection, like, oh, you are stressed out. You need to see a psychiatrist. You need to see a counselor. You need to talk to your life coach, you need to talk to your wife more, you need to talk to like maybe your kids. That doesn't really work in most of the conditions because oftentimes they are not addressing the root. Okay, so which is the reason why understanding fatigue requires examining of the whole person. It's not just the isolated symptoms. Okay. Now, going to the next slide, we are going to try to differentiate between two major topics, okay? Especially in the English-speaking world or English-speaking societies. People actually separate these two categories, on their behalf. Sorry. I'm not sure what's going on. Let me see. Okay. Should be fine. Quite interestingly, it's some problem on my end. Okay, now we shall continue, and yeah, just they're trying to separate these two topics as far as possible, trying to isolate different symptoms from these. Actually, we could say like from a big branch, okay, from a big root into two big branches. That is fatigue and burnout. Okay. So in Western medicine, whatever they say, or the physical or like metaphysical interpretation of fatigue is that you are suffering from physical exhaustion after exertion. Okay, so maybe after a long day of labor job, maybe after a long day of hike or long time of walking or like doing garden works in your backyard, you might feel a little bit fatigued, exhausted. Okay. And oftentimes it's recoverable with adequate rest. Just note here, adequate rest does not equal to regular rest, okay? Adequate rest is quite interestingly discussed in a lot of literatures that they oftentimes self-conflict, okay? And oftentimes fatigue is just body's natural, normal regulatory response. You feel tired, body's sending signals to you, hey, stop. You oftentimes get better with sleep, recovery time, or just a boost of energy after a can of Red Bull. Okay, that's a definition from Western medicine about fatigue. Going to burnout. Burnout is a very interesting topic that these days is overlooked more into professionals. Okay, it doesn't matter, it's just medical professional or like maybe statistical professional or anything like that. Anything that requires a lot of or extensive brain work or mental activities would be classified into this category. So with burnout, they say, oh, you are having chronic stress response patterns. Okay, you are forced to be stuck in a very stressful environment, and oftentimes this kind of feeling of I'm burnt out, I'm just so tired, oftentimes is persistent despite resting periods. Resting does not recover you. And oftentimes it's a systematic overload and emotional depletion, while oftentimes Western medicine focus heavily on emotional depletion while they have no idea whatever the solution for burnout is. They're just recommending, okay, go rest. That's the best you can do. Take a vacation, right? But we all know like you can't just leave your work because you only have like very few days about your annual vacation or something like that, or your boss needs you, or you are working a very crucial position that the company just can't leave you, right? So oftentimes stuck into this kind of stressful or like your working just overload every day would lead into a very unfortunate result is that you are going to start to experience the loss of meaning and motivation in life. What is the meaning of life? I don't want to work. I don't want to do anything. All I want is just go home, sleep. But I can't sleep well. I'm just stay on my phone, watching TV, doom scrolling. Like I don't want to do anything. I have completely lost any interest of doing anything. No hobbies, no friends, or I have friends, I don't want to talk to them. Okay, it's quite severe these days about this kind of burnout syndrome. Okay, and oftentimes it erodes senses of professional identity, and oftentimes comes from the professional identity or the stress that is being just added to the burdens you'll have to carry from the professional identity. Okay. Now, let's look at the topics of fatigue from a traditional Chinese medicine perspective. Okay. And of course, I know like you already had a couple seminars or a couple talks before me. So we'll just very briefly go over all of this, but focus more of the topics in later, slides. So everybody knows what is qi, what is yin, what is yang, what is blood, as I believe most of the speakers before me has already mentioned or went through this. Okay. One thing I want to point out is that fatigue can happen for multiple combinations of these kind of different interactions. Okay. And oftentimes disruption in one system affects the whole system. That is why, referring back to the previous slides, like we can't really just follow the route of the Western medicine that, symptom, okay, here's your decoction, here's your solution. But instead, we have to look at the individual as a person, as a whole well-being to treat their problems, okay? And of course, treatment aims to restore harmony rather than target symptoms in isolation, okay? Now, going to the detailed slides, okay, we're trying to spend more time on this as we are trying to discuss or deliver the meaning of, basically, we're trying to teach you how to self-diagnose yourself, okay? So let's go over some of the important organs, okay? Again, I believe this must be, mentioned by my predecessing speakers, but let's just go over them again, okay? For lung, its function is to control respiration, qi movement of the body, as you can, imagine. Breathing in, breathing out, right? Deep breaths, that's where our qi come from. That's air, like do the oxygen exchange inside our body at, right? What does it do? It regulates breathing and supports circulation of qi throughout the body. But when something happens to it, weakness of lung leads to reduced qi production and poor energy distribution, okay? And symptoms may include shortness of breath, weak voice, fatigue after minimal activity, okay? Now we're seeing the correlation from this organ with our topic, fatigue, okay? If you are not breathing enough, of course, in Chinese, we call this kind of symptom 上气不接下气, right? So that means breath you are not able to take right now is trying to actually catch the previous breathing rhythm, okay? You are just very out of breath, you are hyperventilating, okay? And something happens to this, it will exhaust you furthermore, or in a very quick or very rapid, rate, okay? And next organ we're going to talk about is just mainly spleen, okay? Why is it important? Because that's an organ we heavily focus to talk about digestion and transformation of the food essence of whatever nutrient is in our body, okay? This organ converts food into qi and blood that our body uses every day. And also weakness of this organ leads to qi deficiency, fatigue, and also symptoms may include poor appetite, heavy limbs, afternoon tiredness, okay? And also when spleen is deficient, people start to experience one symptom called food coma. Listed in Western medicine fatigue, criteria, very weak parasympathetic nervous system, and it's just not very desirable, okay? Going to heart, of course, everybody knows that governs blood circulation, but in TCM, also very importantly, it stores the mind, okay? Stores the shen of the mind. Governs blood circulation and houses the shen, and also weakness affects blood supply and mental vitality, okay? You can sort of like imagine that a deficiency of heart or something going on with heart leads into like lack of oxygen supply in your blood. That's why you oftentimes feel weakness of the body or of the limb, because why? Your bloodstream is not able to distribute all this oxygen into the place they should be going to, okay? And oftentimes, it can affect your sleep, poor sleep, low motivation, palpitations, anxiety, and mental exhaustion, oftentimes because of its close relationship with our mind. Overthinking, or over worrying, bipolar problems, and also like very quick shifting of mood, oftentimes leading to like weakness of the heart. Okay, for kidney, it's basically just stores essence and vitality. Okay, it stores jing as in jing qi shen jing, right? So it's more of a constitutional energy that our mother passes down to us and governs deep reserves and recovery. Okay, this organ is quite importantly discussed in some of the classical and modern literatures of research journals that people believe that if you're having good kidney function, you're actually able to have a much better recovery rate and quality than other regular people. Okay, so depletion of kidney causes chronic exhaustion, lower back weakness. Okay, and oftentimes this is a reason why elderly people are much more susceptible to fatigue than younger people. Because why? With time passes by and with families, with like having kids or giving birth, we deplete kidney essence. So hence that's a reason why elderly people having problems with lower back pain or like very easy to have like chronic exhaustion. Okay. Last but not least, the liver organ. Okay, this is the most important one among all of these because why? It actually dominates energy flow and regulation of basically everything in the body. Okay, this organ ensures smooth qi movements throughout the body, so it's more like a traffic officer. Like it guides the qi and blood to where it should be, and also stagnation of this liver organ creates blockage and tiredness, as you have already, been delivered the topic or being delivered the content by our previous honorable speaker, Dr. Zheng, and she mentioned like 不通则痛, right? Similar mindset. It's basically just a traffic jam. Okay, frustration, tension, and irregular sleep patterns, and of course, everything causes like blockage of liver and gradually it will increase the level of stress you will experience. And what happens if you have increased level of stress? Again, going back to the previous slides, burnout, right? Burnout. So to conclude from these kind of different organs, we're able to have total about 5 very general patterns or pattern diagnosis about fatigue. Okay. And of course, as you can see, we have already listed on the right side of the slide. So it's qi, blood, yin and yang deficiencies. Okay. And of course, in Hong Kong, specifically about its geographical location, of course, about climate in the southern part of China or southern part of Asia or any place in the world that is close to equator, where it's hot and humid, then of course we have dampness accumulation pattern. Okay. We're going to look at these one by one in the next coming up slides. Okay. So first of all, it's going to be qi deficiency. So again, the causes of qi deficiency, as we mentioned, or as you've guessed it, so poor diet. Okay. Irregular meals, not eating on time, or not having a very good lifestyle. Just like, Hong Kong is very busy, especially for the people living and working in Hong Kong. Very stressful, very busy. You don't have like a set time to eat. Oftentimes you order like takeouts, right? It would lead into like qi depletion or like weakness of your spleen. So irregular meals or excessive inadequate foods. Okay, these days office working people, like they're very stationary, they don't stretch, they don't work out, or don't have enough time to work out because again work has depleted them already. Anything that comes into simple, high grease, high salt would be in their favor to order. Okay. So aside from this, emotional accumulation, overthinking and worry, again, stress from work, from life, right? Very high like life paces in Hong Kong, like living style, very, very stressful. And also sudden grief and sorrow, loss of a family member, loss of a loved one, like breakup, right? Like child gets sick. A lot of these kind of like worrying, grief or sorrow leading to like emotional accumulation. And again, of course, depression or bipolar, like mental or psychological conditions. Okay. Some physical depletion could also lead into qi deficiency, which like chronic overwork or inadequate rest depletes qi reserves. So that's why you should never, or not say you should never, but you should try to reduce it at your best, at least try your best to reduce the amount of overtime you are working for the company, okay? And of course, excessive life-draining behaviors like overindulgence in sexual behavior, smoking, sleep deprivation, like just the not sleeping, right? Would all leading to qi deficiency, basically. Symptoms, heaviness in the limb and general lethargy. Just to be very specific, like expanding on the details of these symptoms. Usually these kind of things go throughout the day, okay? Not where it's not in the morning specifically. You have to like really differentiate. These two are quite individualized different symptoms, okay? Like just throughout the day, like, body is tight, like just sore and of course very heavy, no energy, I don't want to move, I want to be very stationary and still. This would be the symptom, okay? Poor appetite with early satiety, like I don't want to eat, I don't feel like I'm in the mood of eating lunch today, something like that. Falling sensation of the organs, lightheadedness, rarely, but it can happen. Usually to ladies, like during menstrual cycle or like male after surgery, something like that, or visceral herniation, where you have a prolapse organ. Okay, lightheadedness oftentimes you can be translated or interpreted into like low blood sugar level or low blood pressure level, whereas that's qi deficiency, right? So quite interestingly, you see the alignment between Western medicine and Chinese medicine, right? Fatigue that worsens after eating or exertion, as we mentioned, like reduced parasympathetic nervous system functionality, whereas the blood does not flow into the stomach properly and does not extract the food essence properly, right? And also, most importantly, on the mental side, lack of ability to execute, okay? A lot of people suffer from procrastination these days. A lot. I kid you not, it's a lot of people, more than you can imagine. And why? Qi deficiency it is, okay? Because it's just essentially lack of energy, okay? For some food recommendations, it's very interestingly like aligned with, again, some other speakers' topic. Just some red dates, astragalus or huangqi or bakei, oatmeal, sweet potato, eggs, chicken. I mean, other speakers have already mentioned about these kind of food recommendations. So we'll just briefly go over them, okay? Going to blood deficiency, okay? Blood deficiency is actually quite interesting. These much more popular general level of fatigue that one can experience, okay? Oftentimes much more common in women or in female groups than male, okay? Why? Because again, our beloved lady group, you guys have menstrual cycle, okay? You bleed every month. And of course, a shout out to you guys, very brave, because I can't imagine if I have that or I need to bleed like that amount every month, right? Excessive mental activities, phone usage, mentally demanding job, human interaction, like anything that is a little bit more chronic, little bit longer in time, a little bit more draining than qi deficiency type, you go into the blood deficiency type, okay? Physical strain, prolonged screen time, oftentimes you are staring into the screen so long that your eyes becomes dry, oftentimes a blood deficiency type, okay? Surgery, I have highlighted for you, so it's very interestingly one of the major causes. Overwork of the body, again, excessive life-draining behaviors for ladies most of the time, okay? For symptoms of the fatigue, oftentimes patient or people would complain about, oh, I'm feeling a little bit dizzy, like why the world is shaking, why the world is turning, like 脚浮浮, right? Something kind of like walking on the cloud sensation, okay? That would be the blood deficiency type. And oftentimes into the manifestation on body, you'll have like skin dryness or like dry eyes, as we already mentioned, scanty amount of menstrual flow or poor memory, okay? But in this kind of pattern, we all have like one general, very specific symptom that is bothering dreams, okay? Not necessarily scary, like No, you are not chased by a monster. However, you are getting chased by your boss. Okay, you are getting chased by your friend, or you dream of a long lost friend. Why do I dream about him? Or sometimes like you think about this seminar, like of course you dream about, oh, why am I listening to the seminar again? Well, I'm dreaming, right? So oftentimes these bothering dreams, like why makes you wonder, are oftentimes falling to the blood deficiency type. Okay. For the food recommendations, like dark leafy greens, pork, liver, beef, spinach, anything iron rich would be suitable for this kind of pattern. Okay. Yin deficiency, quite interestingly, well, it's just more advanced stage of blood deficiency, okay? Much more prominent in the menopausal groups. Well, ladies in their late 40s, early 50s, right? You suffer from this, or like from overeating inadequate foods like spicy or greasy, like again, you have the temporary 以黑 or 上火 pattern from the our childhood, like moms speaking, and oftentimes you're stuck in that kind of like 上火 or 以黑 condition for a very long time. Okay. And oftentimes for Hong Kong people, like if you're overeating greasy foods, that could lead into this. And also it can come from emotional factors. Okay. Symptoms like steaming bones and afternoon fever rarely, because that's the end stage of this kind of pattern diagnosis. But oftentimes you're going to find ourselves much more thirstier than usual. You drink of water, but oftentimes not in big gulps, but in small sips, like this. Okay, just in smaller sips, like always sipping on. Sweating at night, scary dreams. Okay, this is an advanced pattern from the blood deficiency. And now we're having like scary dreams. Okay, you're dreaming of monster chasing you, like all of this kind of scary things. And oftentimes you sleep with your hands and foot outside of your duvet, outside of your sheets. Okay, because why? That is a pattern we call 五星反热, 5 center heat. Okay, 5 center heat. You just feel like I'm just warm. I'm just so hot. I don't know why. Okay. Food recommendations, again, some tofu, some yin er, some bai he, as previous Dr. Zheng already mentioned, for yin deficiency patterns. Okay. Yang deficiency pattern is just more advanced stage of qi deficiency. Okay, very interesting, very straightforward. But again, in this pattern, we are seeing more of a cold symptoms. Okay, so cold hands and feet, do not like to drink water. However, people like these, they oftentimes hold a cup of hot beverage just to warm up their hands because they feel cold. Okay, and oftentimes in mental aspect or burnout, fatigue, you'll see like fatigue with lack of motivation in life. Like this is a burnout level. Okay, just that, oh my god, I'm so tired, I don't want to go to work, I don't want to live anymore, I don't know the meaning of life, loss of direction in life, basically. Okay, some food recommendations: ginger, cinnamon, lamb, pumpkin, chives, or longan meat. Okay, 龙眼 or 桂圆肉, walnut, as Dr. Zheng has already mentioned. Okay, now coming to the most interesting or most demanding thing, that is what we can do for dampness accumulation. Okay, some of the reasons, again, I have already listed here: some climate, weather, some diet, inadequacy, and of course some cultural dietary structure. And again, now you see heaviness in the limbs and general lethargy, but in the morning you feel sluggish. Just, I can't get up, the bed is too warm and comfortable. I just takes a long time for me to wake up. And also, as the very famous actor from Hong Kong, Guo Fucheng, right? He also mentions like, I have to drink coffee every day, like, 我一定要饮咖啡, right? Some that's basically dampness accumulation. Okay, brain fog as well, and of course, just a very interesting overall condition in Hong Kong, and of course in Vancouver especially. Okay, some of the food recommendation we are able to see here: chenpi, fuling, right? 起小豆 or 赤小豆, red beans, but not the regular adzuki beans. And of course, just try to avoid greasy foods mainly. Okay, now again, the treatment principles of fatigue is very simple. So just tonify the deficiency, clear stagnation, but we also want to make sure that we address the root cause. Okay. And just in the end, some lifestyle modification for restoring energy for you. Basically, just to practice your dietary patterns or principles. Try to eat more regularly, and of course, minimize cold raw foods. Like basically, every dose or being emphasized again and again and again and again, like countless time through our life, and also by other doctors before me, I'm sure. Sleep hygiene, right? You want to aim for 7 to 9 hours of sleep. Try to sleep a little bit more and also keep your bedroom cool, okay? You can also do some gentle movement and qigong, and of course, Dr. Zheng has already mentioned about this in her last bit of slides. Like you can do some Baduanjing or some Tai Chi, okay? And of course, due to time limitation, that will be the end of today's seminar. And thank you all for coming, and thanks for the invitation from the Alliance of TCM associations. Thank you.
Thank you very much for Dr. Neil Bosendorf. Thank you so much.
Thank you.
Okay, thanks. So our next presenter is Changqing Yang. Changqing Yang, Dr. Yang, are you there? Dr. Yang? Okay. Joseph Yang, right? You didn't you mute your voice. Yeah, okay. Okay, so and our next presenter is Changqing Yang. Dr. Yang Changqing is originally from China and is a physician and a licensed acupuncturist based in the United States. He specializes in traditional Chinese medicine, psychiatry, and mental health, integrating TCM with modern psychiatric medicine and to treat emotional and psychological disorders. Today, he will present a brief overview of emotions and the Qi movement in TCM. Okay, welcome, Dr. Yang. You can start. You have to unmute. You have to unmute your voice. No sound. You have to unmute.
Yeah, I unmuted.
Good.
Okay, sorry.
Okay, go ahead.
I couldn't do the function just right now. Let's restart it, okay. Sorry, okay. Let me share my slides. And thank you for Dr. Xu introduce myself. And thank you for waiting. Thank you for having me, for the great opportunity to give a little bit of my talking. So today I'm focusing on what we call the next slide here. The brief overview of the emotion and the qi, we call the qi movement. So this is a very interesting topic. Also it's a very core concept regarding our, the clinic practice, especially when you practice in the mental health. Okay, let's go next. So if you will have listened to my class before, anything I talked, it's very important you have to know the Shen Qi. So the Jing is matter-based idea in the wide meanings. Narrowed down 5 organ Jing and more narrowed down its kidney essence. That's what's called the Jing. The Shen is different. Shen is life. The narrowed meaning of the Shen is our mentality. That's why in Chinese medicine we don't have such like a psychology or something. But the more important, we know the Shen phenomenon, all the functions, that's all included in the Shen, these words. So when you put the Qi together, it's very clear. Jing Qi, talking about the mature type of Qi. When you put the Shen together, Shen Qi, life energy. That's why you're gaining Shen is prosperous, you're losing Shen. Your life energy will be weakened or it disappears. So that's very vital and dangerous. Okay, so Jing is what? Jing is like a room, store the Shen inside, and the Shen resides inside the Jing. And the Jing and the Shen always harmonize together since we were fertilized in the uterus as the fetus. Okay, now I have to give you this called the Chinese medicine. We call it Ben Shen psychotherapy. Some of the basic principle. For example, the Qi Bo answers questions, and they're talking about generally for human nature, everyone is afraid of death and prefers life. So that means everyone you prefer continue to survive better. So here, the death and the life not just means death. It means you're descending, falling, failure, and then you can be alive. Means you want to rising, you want to make achievement, you want to make successful life. That's very important. And also when you do the psychotherapy, we have learned this kind of the techniques, one with failure, talking with its goodness, like encouraging based, guide with convenience, we call it Dao, guiding, and also we call it opening with when suffer, so let people damp the psychological trash. So if you know this kind of general principle, you know this kind of techniques, so Qi Bo said, even an unreasoned person will listen. Okay, so we go to next. So this word famous, they call it 5-type Qi theory. This in the classic repetitively, for the generations, even the books copy each other. Where's the origin? That's the Su Wen Ju Tong Lun. So that's the Su Wen chapter 39, the treatise of Pain. So here talking about something very, very important. You see here called the anger raises the Qi. So today we make a lot of mistakes. In the clinic, many people talking anger make the Qi stagnation. Liver Qi stagnation, right? That's not very important. The anger raises the Qi, 怒则其上. So we have anger in general, your Qi energy rising, so you feel a lot of pressure, ups, thrust, this kind of tension. That's really the anger make. So I don't know, people talking here and then listen to the personal story, not the Neijing principle. So causing a lot of trouble. And even in the organ level, they're talking liver Qi, Su's Qi. They forgot that lung Qi is governing the Qi, the liver governing the blood, heart governing vessels, spleen governing nutrition, kidney governing essence. That's okay. When you go deeper practice, you go to more detailed evaluation in the clinic. When you try to read more and more classics, we know we are in this kind of mistakes for so long. Okay, when people are joyful on the mood, what happens? Slower the Qi. What the sadness makes? They call it consume the Qi, 背着气消. So that's why in the clinic, when people have sadness, you have to try to let the patients more resting, more nutritious. So that's why in the clinic, when I observing my intern, when another one make a lot of liver qi extinction and have to change it back to the qi consumed, qi weakness based diagnosis. Okay, so 恐则qi下的 fear descended qi. So that's why people want to escape, want to hide somewhere. So when I make a qi diagnosis, I have to try to find a way. No, the qi is descending. The qi is leaking, is awakening too. So that's totally not a liver qi extinction. So many things wrong in the clinic right now. And the coldness make the qi binding. June, the heat make the qi leaking. And the labor make the qi exhausted. And also we have the pensiveness. Let me do the pensiveness first. The pensiveness make the qi stagnation. So you couldn't figure things out, you couldn't find a solution. You keep thinking over and over again. That kind of thinking over again, that kind of mood is called pensiveness. That's a great contribution to today's even the psychology. Because in the Western psychology, they don't have this kind of idea. So TCM has this idea called the pensiveness, make the qi stagnated. You have to very be careful. There are no liver qi related. So people make the liver qi writing spleen or the liver qi writing stomach. As it's anger based, it's no anger. No anger where's the liver? Because we learn in the textbook, we learn from school. No, people worry, concerning, no liver, no anger. It's just the pensiveness, make it a qi stagnation. The Neijing is right, not our textbook today. Okay, the last one, we panic. The panic is very special. The panic make the qi confused. They mess up everything. So follow the Neijing principle they're talking about. When you have the panic, people know where, the shen know where to rely on, the heart know where to resting, right? So our the Lü, right? The thinking, the nowhere to settle down, right? Our pondering, nowhere to settle down. That's why the qi is confused. So when people have stress, panic based, that's nothing related to liver qi at all, right? So more related to heart or lung, that's major. People with strong palpitations, a choking feeling, or maybe some kind of the urination trouble, the kid leaking urine, right? Or crunching the abdomen, or some shaking. All the organ, internal vein, the kidneys, middle jaw, all kind of happen. But the heart, breathing, the lung, that's the major symptoms. That's why qi confused. So that's the clinical real science. So make a liver qi stagnation, it totally make no sense. Okay, the no psychiatric background, so people blindly listen to the personal story, that's not good. No. Okay, and we talked already, the 4 major treatment due to the time. I don't want to talk more here. Let me go to the emotion-based. So when people have the qi, the joy is like the qi. So when you start to communicate with this kind of people, you have to be serious. We know the warning, talking, opening, guiding, right? The techniques. So these kind of people, you have communication, but don't forget you give warning. So let them take things seriously. Don't be sluggish. So that's the basic techniques. In case you have to give some kind of we'll call it encouragement, right? And let people talk what happened to open it. If the people drinking marijuana not the seriously make a schedule, so you have to let guiding energy towards the normal managing based. So that's kind of mindset. So, and also let the people make a nature connected some exercise. For example, we call it concentration based. Watch the greens, the trees, the flows, certain things, beautiful things. Concentrated watching and watch the detail to train the internal, the shen qi connected with nature. Don't move away. And also do the self-exercise. For example, telling self, I'm okay, I'm ready, I'm here, I have concentrated here. The self-suggestion based. Or close eye, concentrate internal. I want to stay here for as long as 15 minutes. Don't jump away. So for the, we have some points. For example, for general people, you can do called hard points based. like heart 7, heart 6, heart 5, heart 4. We call the wrist heart 4 points. You can do massage and make it harmonize with the breathing cycle. Formulas related many things can make the qi more stronger, strengthen the qi, tonify the qi. If no fire, no heat, generally you go 补心汤, you go 四君子汤, that's fine. If with heat based, you may think about there's some hot fire based, like a 天王补心丹 or something else. That's relatively easy, but we don't have time to talk more. Okay, now, very important. The anger raises the qi. When people have the anger on the emotion waves, you had to wait in general. So everything is birth, growth, peaked, later descending and disappear, right? And it's called 生长化收藏. Our emotions, thinking, desire, insight, everything take this kind of cycle. The anger can be quickly comes, but also can be disappear as well. Wait until the patient take 5 minutes, 10 minutes resting, then start to talk and talking very gently. And remember, conversation first, try to find a way and understand what happened. You can use the opening to let the patients complain what's anger. Is the anger just happened because you got the parking ticket because your clinic is so difficult to park? Or had an argument with a family member or from working anyway to find a way. And later followed, we call it talking, and we have the warning to let them know. That's all we have. This kind of the major, we have the prevention psychotherapy techniques. That should be fine. Connect with the nature for anger rising energy based, the qi based. You let the patient do more activity and do the physical. You can release some kind of tension of the body to the healthy mind. And self-exercise, for example, you can use the tone, we call the hu, ho. That's kind of the words to release the anger. Take certain positions, strongly make the voice to release anger. That's good too. And for the points massage based, easy. You do the liver massage based, liver channel massage based. Soothe the down towards the toes, and then make harmony with the breathing cycles. Good too. And for typical liver qi tension, we have Chehu Shugan San. Even with some burning heat, rising fire, yang rising, so many formulas, right? Jiawi Xiaoyao San, or even the Huanglian Jiedu Tang, you want to join the heat, Long Dan Qi Gan Tang, all fine. But anyway, it's the simple one for English speaker. You can find such formula in the English book. My books not really give this kind of simple formula. Most all from the classic, the uncommon formula, not available in today's book. Okay, let's go to next. So pensiveness comes, right? So work with the pensiveness, the patient, you need to be very patient and wait. And then make a good greetings. Try to let the patients to talk. And encourage patients to open, and let the patients to open themselves, and leading to the patients something else to change that kind of pensive emotion, the knots. It can make things better. And also, we need to connect with nature, also do the movement based, jogging, walking, put the feet into the ocean, the water, walk on the grass, do exercise. Also tell the patient how to do the simple qigong exercise. Also all good. The safe exercise, for example, safe suggestion based, tell the patient that I'm fine. The sky not falling, not just you feel the stress. Also, we let the patients do breathing with the physical movement based. Also, we call let the patient, read something aloud, like a poem, some articles, to soothe the qi. I'm not soothing the liver qi, not telling this way. We soothe the middle jiao, the yi shen, the qi, the pensiveness, the qi. There's no liver involved. Okay, the formula, that's fine. 香砂养胃丸, 香砂顺气丸. and Mu Xiang Shun Qi Wan, even Yue Ju Wan, that's all can make this kind of stinginess better. Okay, next, sadness. It's terrible when they make liver resignation. People in the grieving period of time need good resting, good nutrition. When you start talking, you have to watch the patient emotion to make a sympathy there, but also have to control your own mood as well. Don't make the trouble called emotion transference. And also support patients. Tell patients, and try to understand you, I support you. I know your tragedy, I know your grieving mood. And try to use the courage-based called Yu, talking with encouragement. Also let the patients open their sadness, some kind of that kind of traumatized story, anything. And take time, let the patient talk. And also let the patient walk under the sunshine, open space, and go out the door, meet friends, meet family members, in case go back to hometown to deal with any type of sadness. And do the exercise gradually. People in the sadness, the energy is descending, consumed. So do the proper exercise from the simple and do something more. The acupressure massage the lung, massage the lower, the dantian abdomen, try to reserve energy, recover the energy. For formulas, very important, you give nourishing based, like a Gui Tang, Ba Zhen Tang, Shi Quan Da Bu Tang, nutrition based, that can recover this kind of sad energy, consume the qi better. Don't do liver qi, please. Okay, next one, fear. Fear is the descent of the qi. The people try to escape, try to avoid, try to walk away, and even timid and stay inside the home or something. The fear directly can damage the kidney qi. You patient come to see you, the people most of the time related worry, related fear, they diagnose some anxiety or some kind of, but anyway, you tell the patient, say, you're fine, you're good, you don't worry. Let it find a way. How do you feel this way? Is there any reason how do you feel this way, right? Let the patient to talk, to share, open, and then give encouraging talk. If patient do the wrong, some kind of bad behavior, you give warning. So that's all fine. And then guiding the patient energy towards a healthy way. For example, meet the friends, meet someone they love, and they try to find a comfortable, some kind of environment to do something. Related to nature for fear-based, the qi is descending. We need the morning-based, rising-based energy. Also in the clinic, for sadness, fear-based, it's better you do the morning treatment. We call it follow the tianshi, follow the nature timing. You make things better. And it's self-exercise and tell yourself, okay, I'm still good. I can deal with that. I can recover from that. This kind of self-suggestion makes a great sense. You maybe think it's modern techniques. No, the traditional Chinese medicine doors use this kind of self-suggestion a lot. They use the natural words, they use the Dao words, they use certain Chinese medicine words. Today we use the common, people easy to understand simple words. For example, I'm fine, I can do it, I can overcome it. It's just this kind of simple word, repetitively speak out. You can let yourself get more stronger. And try to find a environment to deal with the people and also communicate with the people. And say, yes, I can do it. I let him communicate with the people to see what happened. And go to certain area, go to some association or some organization, even a government, certain agency to find a way if we have certain things difficult. Anyway, positive deal with this kind of fear. As doctor, you have give suggestions. For formula descending based, absolutely. Give the rising based. Tonic leave the qi based, all rising based. For example, tonic by kidney qi, you can give Jinggu Shen Qi Wan, fine. And also you can give Ren Shen Yang Rong Tang, good. And also if the people develop a lot of coldness, you give Jinggu Shen Qi and Bai Wei Di Huang, all fine. So just in case, you can give the formulas to deal with this kind of kidney damage because the qi descended too much. So that's the simple talking related. Even the acupuncture point massage, kidney points are very good. Lower dantian, the chung channel, that's also kidney. The point combined is good too. And combined with the breathing cycle, even add imagination. For example, imagine the blue sky or the qi rising from dantian to the top. Okay, the time is coming. I have to stop here. Let me see. Oh, we have panic, right? Okay, panic when qi can scatter. When you deal with the patients, you have to be very steady. Will make a tone also very, very stable. Don't follow patients, the panic, the emotion. And let the patient to open their heart, to tell you what happened, and talk to patient, give encouragement, tell the patient, saying, you don't have a heart attack, your breathing is okay, you had such things before. Watch me, let him take pause. Follow me, do the deep breathing, to control the patients back to normal. If the patients go to back home, let them go to the nature to learn deep breathing, and they try to find a way more soothing that kind of environment, like a park, the ocean, open places. Even go outside with a family member, friends, reduce any unpredicted situation, and do the self-exercise. Time to tell myself, I'm not a panic person. I'm okay. I'm internally should be stable. I'm the person I can deal with this kind of situation. Blah blah. That's fine. If some emotion comes, acupressure comes, heart 7, PC6, very easy to press. Press a little bit hard, tight. Deep breathing and breathing out. So that makes sense. And related to the formula based, for example, we have Longu, Chai Hu Jia Longu Muli Tang, Gui Zhi Jia Longu Muli Tang, such formula anchoring. Also good too. If the patient is deficiency, weakness, Ganmai Da Dao Tang, something also works too. But any formula I talked about all require professional, the Chinese medicine doctor to give you advice. Don't do by yourself. Okay, yep. Sorry, past timing. Okay, that's my book. Okay, that's my institute, my personal clinic. Thank you very much, everyone. Thank you.
Thank you, Dr. Yang. Excellent presentation. Thank you very much.
Thank you.
Okay, so that concludes today's presentation. Thank you again for everyone for joining us today. Sincere thanks to all of our speakers from their excellent presentations, and to all participants for your support and encouragement. We hope today's session have been informative and inspiring. Thank you for being part of the 2026 World TCM and Acupuncture Week. We look forward to seeing you again. Hope we'll see you next year. Have a wonderful day. Bye, everyone. We stop here.